Hi, this is Taiga Nishihori from Department of Blood and Marrow Transplant and Cellular Immunotherapy at Moffitt. We're presenting the results of phase 2 multicenter study of double-blind placebo-controlled trial of maintenance ixazomib in high-risk multiple myeloma. This study derived from Moffitt's internal idea of combining proteasome inhibitor bortezomib with fludarabine melphalan conditioning and building upon the prior BMT CTN trial showing progression-free survival improvement in HLA-matched sibling donor transplantation. This study enrolled 57 patients and treated them with fludarabine melphalan, bortezomib conditioning, and randomizing them around 2 to 3 months after transplant to ixazomib versus placebo. This trial, unfortunately, was put on hold initially after some toxicity concerns, and we modified the protocol by removing bortezomib after transplant and continued with therapy. So 57 patients were enrolled, and in total, progression-free survival and overall survival were similar between the groups, so there was no significant impact of ixazomib seen, at least on this particular trial. Overall, OS at 2 years was 82%, and transplant-related mortality at 2 years was 11.7%, which is fairly reasonable. And for patients who were transplanted after protocol modification, transplant-related mortality at 24 months was 8.7%. Again, suggesting this platform's feasibility for high-risk multiple myeloma patients. So in the future, we will probably anticipate a better trial design and asking the question of should the allogeneic transplantation be considered for high-risk multiple myeloma patients.